Many medications can cause side effects. A side effect is an adverse response to a drug when taken in normal doses. It can be mild or severe, temporary or permanent. The side effects listed below are not experienced by everyone who takes this medicine. If you are concerned about side effects, discuss the risks and benefits of this medication with your doctor.
ZOLOFT side effects. ZOLOFT, or sertraline, is an antidepressant medication. It's used to treat depression and anxiety disorders. ZOLOFT can also be used as a maintenance treatment for people who have had recurrent depression. When taking ZOLOFT, you may experience certain side effects. Some of these side effects are common while others are rare. The most common side effects include nausea, diarrhea, dizziness, and headache. Less common ZOLOFT side effects include sleepiness, confusion, and weight changes. Serious side effects are rare but possible with any medication including ZOLOFT. These serious side effects include thoughts of suicide or violence towards yourself or others, seizures, convulsions, difficulty breathing, swelling in your hands or feet, fainting because of low blood pressure, rapid heart rate, increased sweating, severe muscle stiffness, tremor or shaking of your hands or feet, uncontrolled movements such as tics, repeated sounds or motions.
Some people may experience side effects other than those listed. Consult your doctor if you notice any symptom that worries you while using this medication. Before using any medication, be sure to tell your doctor about any medical conditions or allergies you may have, the medications you use, and any other important facts about your health. Women should mention if they are pregnant or breastfeeding. These factors may influence how you should use this medicine.